we now have to move on to our Texas collaborator, Dr. Berge Minassian. Berge, I think you'll be joined with Felix, I can't pronounce his last name, but you will. And we look forward to your presentation and the work that you've been doing down in the University of Texas.
Thank you, Ed, and thank you everyone in the organizing committee. Yes, I will be joined by Dr. Nitschke, who's a colleague of mine here, who's worked on Lafora disease and APBD for a long time with me in Canada, and now is his own assistant professor scientist here, continued to be committed to these diseases. And a special thanks to Deborah for those comments and the very poignant way in which you presented kind of a typical life of a patient with this disease. So given that my good friends Or and Orhan gave the introductions, that would help me not waste time on that. That's been explained very well. So I will just jump into some background, kind of what we're doing, and then I'll leave the floor to Dr. Nitschke to discuss biomarker development. The biomarker development he will talk about involves measuring glycogen in CSF. Our time is very short. We have another biomarker concept, and that is seeing whether we can see polyglucosan bodies in the retina of patients through advanced ophthalmological examinations. But I don't have time to go through that now. Also, we do not have preliminary results on that yet, but we would like to do that because it's a totally non-invasive approach. As was mentioned, one of the ways to treat any monogenic disease is to replace the disease gene, and we are hard at work now in doing gene therapy in APBD. We did a pilot study where we introduced the gene in neonatal mice just to see as a proof of principle if that worked. And it really works very well. This is just a very preliminary slide, and this was a pilot project. And you see this, the more brown here indicates the virus has spread in the mouse. And if you look at the polyglucosan bodies, which are all the, replacing the gene actually makes it work, and the polyglucosan bodies do not form or don't form as much. And we are moving this forward now to a long study to take the mice into the ages of 8, 9, 12 months where they usually die, and see if we can rescue the mice and hopefully advance gene therapy forward for APBD. The other approach for this disease, as both Or and Orhan mentioned and Or detailed, is to return the balance of activities between glycogen synthase, the elongating enzyme, and branching enzyme, the branching enzyme, towards a better balance, therefore down-regulating glycogen synthase. And so we did experiments where we bred together mice deficient of glycogen synthase and mice with APBD, the same mice that Orhan had developed, the single point mutation mouse. And just quickly through those, because you have seen those before, this also works very well. It rescues the lifespan of the animals, various features, the motor features, balance features, and importantly, the pathological features. As you see here, this column shows the animals with the mutation and all the polyglucosan bodies, the inflammation that it accompanies it, and all of that gets improved, essentially normalized, when you return things to balance. And this has led us to use an antisense oligo, in this case, targeting glycogen synthase. This is a different antisense oligo from the one that Or described. This one targets glycogen synthase to down-regulate it and return the balance. And again, this works quite nicely. Again, this is in collaboration with Ionis Pharmaceuticals, and the polyglucosan bodies basically are much, much less with the various antisense oligos compared to just a mismatch or just buffer used. So these approaches all work. This is a quantification of the polyglucosan bodies. And again, you see how they normalize. So we have many approaches going between all of us in this community, but we need a good biomarker to kind of follow things in patients. And I will now switch to Dr. Nitschke, who will talk about the work we're doing in developing a CSF biomarker to measure glycogen. You will hear lectures later. I'm so pleased that Dr. Gentry has joined this community, and we collaborate closely with him on various aspects related to this disease and the sister disease, Lafora disease. But let me give the floor to Dr. Nitschke.